sort of key kind of biologic pathway or cell signaling pathway that's really involved in MPNs and myelofibrosis is the JAK-STAT pathway. And that in particular was, really advanced in 2005 when we found out about the JAK2 mutation in a large percentage of these patients, subsequently MPL and CALR mutations as well. And what we find is that really in all MPN patients, all myelofibrosis patients, sort of irrespective of those mutations, is that we see activation of this JAK-STAT signaling pathway, and which has a lot of different effects and can kind of break those up into effects on hematopoiesis or sort of how they affect sort of blood cell production and hematopoietic. And then also, increases in inflammatory cytokine signaling. The JAK-STAT pathway signals through a lot of cytokine and inflammatory receptors. And so we see a lot of inflammatory signaling increase in a number of different cytokine levels and in myelofibrosis that really impact the disease, the symptoms that we see and things as well. And so, what I think that's been, really key to the biology that we've known for a little bit of time now and really has led to the development of JAK inhibitors, of course. And I think we've, started to move beyond that pathway a little bit as well. And so a lot of the research now and new agents that are being sort of explored in clinical trials is largely looking at non-JAK inhibitor agents, right? Sort of combining other pathways such as BET inhibitors and various other signaling molecules, anti-fibrotic type compounds, all that have additional sort of roles in addition to just the JAK-STAT pathway in myelofibrosis.